Live from Fargo and serving you on TV, online, and on the go. This is Valley News Live at 10.
A scientist who worked on the response to Ebola is looking at how to stop the spread of coronavirus. The researcher uses complex math to analyze pandemics as they happen. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
An MIT-trained scientist who studies pandemics says it's possible to end the spread of coronavirus.
We have to pounce on this thing. It's a tremendous adversary.
Yanir Bar-Yam published a paper this month, COVID-19, How to Win.
I mean, it's a really terrible thing to have. And the fact that, 80% of cases are mild, don't let it deceive you.
He says winning isn't easy.
The transmission of this disease is very aggressive and very hard. It's a really tough disease to fight.
Because he says that transmission often takes place right under our roof.
80% of the transmission in China was within family groups. It's within the home.
Bar-Yam writes to beat the virus, every American must be on board. Stay-at-home orders or lockdowns need to be followed. But as of Thursday afternoon, 8 states still haven't issued stay-at-home orders.
Because what happens when you have the core outbreak areas taking it seriously and others not, well, the other areas will eventually get to the exponential growth that's times 10, times 10, times 10. And they're going to be overwhelmed too. And then they're going to institute the lockdown. Why should they wait? We know what it looks like.
He says sick patients must be isolated. Masks must be worn in shared spaces, and the country needs strict travel restrictions. He's a supporter of states restricting travel.
When we do that, then we don't end up in a situation that everyone has to get the disease. There are places that probably don't even have it today, even though it's spread very widely. And the best thing that we can do is to stop it from getting it.
He also says we have to test often and provide results quickly.
And now we're at a stage where the actions that we're taking are kind of enough to keep it about steady, where at least that's kind of where we are, but they're not enough in order to get rid of it, which is where we want to go.
Also new, a CDC study released details more information on people hospitalized with coronavirus. Nearly 90% of all patients have a pre-existing condition. The most common, hypertension or high blood pressure. 72% of all hospitalized patients over the age of 65 had that in common. 45% of older patients had chronic metabolic disease, like diabetes or thyroid dysfunction.
2 more people have died in North Dakota from the coronavirus, bringing the state's total to 6. In all, there have been 269 positive cases in the state. 101 people are listed as recovered. 14 patients remain in the hospital, 2 fewer than Wednesday. Of the 14 new cases reported today, 6 are in Cass County, bringing the county's total case number to 83. Nearly 2,000 people in Cass County have been tested. North Dakota Governor Doug Burgum continues to defend his decision not to issue a stay-at-home order. And there's also been some confusion surrounding the phrase COVID-related. Reporter Jacob Noderman breaks down both stories and defends the governor's justification.
With reports coming out of states having inconsistencies when reporting deaths related to COVID-19, there are questions as to how North Dakota is counting deaths as well. It basically boils down to, did someone die of the coronavirus or die with the coronavirus? State Health Officer Mylan Tufte said that they are aware of these reports and are looking into it.
Is it truly related to COVID, or is it COVID related? And so we are doing education and looking at the science around that. There are individuals that have passed away and do get tested for COVID, and we are resulting those as well and trying to understand what exactly is happening for these fatalities.
Counting deaths is going to affect the models of projecting where this virus goes. And with the national peak day, at least according to the IHME model being Saturday, April 11th, Governor Burgum said that really we should just ignore the IHME model, showing inaccuracies in the data on the North Dakota side. He said that he likes the model, clarifying that, but he doesn't like the data, citing that the model predicts 7 deaths for Friday, according to the IHME model. And he said that he's justifying keeping the state open off of data-driven decisions like this.
On the way back up again, we're going to have to think about how do we open things up slowly so we don't end up, creating a unforecasted spike because suddenly we're quote back to normal. As I said, we won't have normal, we'll have back to the new normal.
While the governor says that he's working on a model, a lot of that involves collecting new variables and new data that other states may not have. And that involves the state's increased capacity in contact tracing, which the governor said they have been training more than 250 people in North Dakota alone to study that and seeing where the spread is going.
Meanwhile, in Minnesota, 11 more people have died from coronavirus. That state's total is now at 50. 145 people remain in the hospital, with 63 of those patients in ICU. 1,242 people in Minnesota have tested positive, and 675 of those no longer need to be isolated. The pandemic has put a sharp focus onto laws several states have, including Minnesota, that limit the number of hospital beds. Minnesota passed its statute decades ago with the idea of it lowering health care costs. One expert says what it ended up doing was discouraging competition and limiting the ICU beds available. Minnesota State Representative Paul Marquardt of Dilworth says the state should take a hard look at this law after the pandemic is over.
Bottom line is, when you have a moratorium like this in place, does it work for a pandemic? Well, no, absolutely not. It doesn't.
North Dakota passed a similar bill in the 1970s, then phased it out in the mid-90s. While heading out to the lake cabin sounds like a good idea, Otter Tail County officials say stay home to prevent community spread from overwhelming the area.
While it's, understand it's well intended, it'd be nice to come and quarantine here. We just don't have the capacity. Because we know there's community spread of COVID-19 and we know some people are asymptomatic, what's well intended may not be for the greater good.
Meanwhile, Becker County officials say coming out to your cabin is fine with them as long as you social distance and wash your hands. The search is on tonight for a man and possibly his 2-year-old daughter after an early morning fire destroyed the home near Hillsboro. Authorities say after searching the rubble, they were not able to locate any bodies. The man who was living in the house that burned is 35-year-old Adam Gettle. Police say that they've tried several times to contact Gettle without success. Prom night has been called off for many high schoolers up and down the valley. At Kindred High School, their enchanted prom theme left them with hundreds of flowers and no place to put them. So instead of tossing them out, they found a new home. Valley News Team's Courtney Lockey shows us how they kept their enchanted forest alive.
Megan Schreiner spent several weeks getting ready for prom at Kindred High School.
I was home working and I got a call from the school about flowers that got delivered for prom, and I was like, flowers, what? And I realized it was the flowers that I had canceled.
Prom was called off because of the pandemic. Still, hundreds of flowers found their way to the school's doorsteps.
And I was like, well, I canceled these. So I go and check and it's all these live flowers. I'm like, well, what am I going to do with almost 400 flowers?
She thought of the people living at Eventide's Cheyenne Crossing Care Center in West Fargo.
It was overwhelming, but it was exciting. The first thing I did, gathered all the vases that we have and started cutting away and getting that baby's breath in there, getting those flowers out of there.
Becky Butenhoff spent the week passing out the 400 flowers to everyone at the nursing home, brightening the days of people like Mabel Orth and Rosie Shasky.
We had some ladies that just cried. They were so excited just to get the company and to get something so beautiful.
Mel and Lucy Johnson, like many, say they were sad the kids didn't get a prom, but to know others were thinking of them meant everything.
You might think it's small, but it's really big.
In West Fargo,
it's wonderful. It's really made everyone's day.
Courtney Lockey, Valley News Live.
What a great idea. Eventide says gestures like this that help them get through tough times, adding they're thankful for Kindred High School. New projections say student enrollment numbers will exceed target enrollment numbers at Discovery Middle School in Fargo and Davies High School in the next 3 years. An option to alleviate the pressure is a school to house 8th and 9th graders built east of Davies High School. The district says plans eventually would turn it into a traditional 6th through 8th grade middle school. On Tuesday, the school board will consider seeking bids to construct the new school for no more than $60 million. We'll have more information on our VNL News app. Smithfield Foods is temporarily closing its plant in Sioux Falls, South Dakota, after dozens of employees tested positive for COVID-19. The company supplies food to some North Dakota grocery stores. It said today that it's going to suspend operations for 3 days so staff can clean and sanitize the building. Employees will be paid during the closure. State officials say 80 employees have tested positive for COVID-19. That particular plant employs around 3,700 people and is one of Sioux Falls' largest employers. British Prime Minister Boris Johnson is out of the intensive care unit, but is still at a British hospital being monitored for COVID-19. Johnson is the only world leader hospitalized for the coronavirus. England has been hit hard by the virus, with just under 8,000 deaths being reported. A senior British health official expects the death toll to keep rising for the next 2 weeks.